Good afternoon, everyone. My name is Vishnu Mayopadhyay. Today I'm here with my brightest nurse practitioner students from different universities. I'm gonna give them a chance to talk about themselves and about the universities. So today we thought of talking about stress management, and I would like to take the opinion because stress management is the number one factor that we come across in medical practices dealing with our patients. So before I give my opinion on stress management, I would like to talk consult with my experts here. So we'll start out with Miss Juliet. Miss Juliet is nurse practitioner student from South University. She is very diligent and very intelligent. This is her second rotation, and I'm very impressed with her performance here at the clinic. And I have seen managing stress very well. She had some ups and downs in the beginning during her clinicals, but she soared through it and she's really flying through her clinicals, doing her exams, her consults, her referrals, her follow-up phone calls. So, Miss Juliet, I'll like to start out from you. What do you think about stress management? How do you incorporate managing stress and managing your work um, in the clinic, at work, at home? I know we all have stress. There's no way we could
Yes,
eliminate
we
stress,
we
but
all have stress. I just live every day. Maybe just take the day as it goes by. That's my philosophy. I don't overthink things. Anything you cannot control, then I mean you just try to work your way through the day. So that's it. I try to with stress. Just don't try to make any, you know, don't let it affect you because we always everybody will have stress even at work and the rest just I don't
yeah,
yes
I got your point. You're saying you should not let it bother you. You should just deal with it and just move on and get the best out of it. So
yes
if you have a patient that comes in and she tells you that she's got a lot of stress in her life, how do you educate her? I mean, three most important things you'll give it out to her on her visit to manage stress.
well me what I'll just sleep, like me personally, nothing can take away my sleep usually. Even if I'm stressed, I may not eat, but I will surely sleep. So just get enough rest,
Very nice.
very important. Then drink a lot of fluids, water helps. And I don't personally do exercises a lot, but exercise can help with stress.
So you will prescribe the medication if they're stressed. That's what you're
There's no
saying.
medication.
SSI,
Exercise.
exercise. Okay, I got your point. Yes, I agree with all those 3 points. Stress relief can be obtained by having a good night's sleep, exercising, and the most important one that you mentioned was drinking a lot of water. Yeah, thank you, Juliet. Now, moving on to Rebecca. Rebecca is one of the brightest MP students from Walden. Rebecca, I'm going to ask you the same question. If you're going to be the queen for one day, what would you do in field of managing stress?
I think my approach would be to organize my so to speak schedule in order of priority. If I have a full day, just like you said, going to school, going to work, you have a family. So my technique has always been to arrange my day in order of priority.
I like that.
You know that what's the deadline for this? Is this a priority? And so that pushes other things behind, and then I know when to say no in because of the priority.
Very nice.
Yeah, so I would exercise. At least I make sure at least I have 3 or 4 days a week, 30 minutes on my elliptical, because physiologically, once the heart is used to taking in that healthy stress, kind of knows how, emotionally, then you're able to manage.
Right.
And then the spiritual aspect of it, so just training the mind to be strong in a positive way.
Right.
Yes. So
Thank you. So, Rebecca, I think this is what I gather from you. If you were going to be the queen for the one day, you're going to have everybody make a a schedule, make the priority, and leave unimportant thing at the back burner and pay attention to the most important. And at the same time, she tries to take care of herself, because if you can take care of yourself, you can manage the stress well. So that's your education to your patients as well. Take care of yourself, so when you are nourished, you could nourish others. Thank you, Rebecca. Now moving on to Rocky. Rocky is NP student from UT Tyler.
Mhm.
About a little bit about Rocky. Rocky is my number 3 NP male student in the practice, and I think he has proven to be the best male NP student who's coming here to do women's health nurse practitioner rotation. But he's done over and above all. He's taken care of kids, he's taken care of women, he's taken care of adults, and he's marveled me in all the fields. And I really want to thank you for being so ahead of the game, for being so smart. Now, in your case, I would like to ask you, do you think stress is important in life?
I think stress is very important. It builds a lot of character. So stress is something inevitable, something you cannot avoid. So the best things for that is to learn how to manage it. The best ways in managing it is to learn how to deal with work-life balance, or work-school balance, or work-school and life balance, depending on what's appropriate for your life. So one way of doing that, the way that I do that, is figuring out what's important to me, just as she was divulging on. Figuring out what's important, whether that be God, sports, family, depending on whatever it is, making time for it. Time will always be there and always be the same. You're always going to have 7 days a week, 24 hours a day. It's not about having time, it's about making time. And I feel like that's the most important factor, especially with making time for school, making time for your family, making time for God, going to church on Sundays, whatever is affiliated to your religion, you know. So with that also being stated, how I would approach my patients. So it's about going to the room, knowing exactly what you're going to be asking, how you're going to be asking it, being appropriate and sensitive to what are you doing. For example, with a kid, you know, you're going to ask a HEDS assessment. For a woman, you're going to ask OB history, sexual health history, men, sexual health history, and whatever is pertinent to their care. That way you can get in, do it quick, but be thorough while doing it. And then also have your resources available. Like for example, what I do is I have my e-textbook always open, as well as the UpToDate app always open, and CDC guidelines. That way that if I need to know how to do something or prescribe something, I have the resources there and something that's appropriate for guidelines. That way I don't have to struggle too long with thinking about what I'm going to be doing, and that's another way of stress management in terms of inside the clinic setting.
Great. So your point of view is, if you have your homework done, if you have taken care of yourself, if you have followed the approach of from going A to Z, you don't have that much of stress because you're also organized and prioritized.
It's not to say that you don't have a lot of stress. There's always going to be stressors there, whether you have a little or a lot. That's
But
just,
you can manage
it's personal
well.
perspective. So yeah, it depends on how you manage it, and that's the most important part of stress management.
So in your opinion, having a little bit of stress is healthy because it makes you more organized and prioritize your stuff?
It varies from person to person. So stress can make or break you, just kind of depending, and it builds character overall, in my opinion. But then again, we do have the patients where stress can ruin their lives, ruin their social habits, and everything in between. And so we just have to be cognizant of those things. But for me particularly, as an FNP student and full-time employee, it's healthy.
Very, very well taken point, Rocky. His point of view is, when patient comes in and they're talking about stress, you need to ask them what is the level of their stress, if it is physiological, which we all go through, or if it's pathological, which we should not go through, and then you deal with that as we go. If it's pathological, we take a step forward. If it's physiological, we just assess them and educate them and move on
Yeah.
with the whatever best we can do. Thank you.
And never invalidate their feelings, you know, because sometimes you say, oh, you're stressed. Oh, I'm stressed too. You know, never invalidate anybody's feelings, because that can make a big difference in their lives.
Now, our next contestant or LP student that I'm gonna ask about stress is Jamie. Jamie is, as you can tell, one of the brightest students from TWU. This is a second rotation. First time she went through very well, and now she's flying. Maybe she's got a couple of days when she will be done from her clinicals. I see Jamie as a young mom with 2 little kids, husband to take care of, and a school and a full-time job. How do you handle your stress? What do you do that I could relate to people out there so they could make a balance like you're making a
I
balance?
mean, just like they've said before, you have to make time for yourself. Sometimes I stress like there's so much to do for school, study, but you have to take that time. You have to make that time for yourself. Whether it's a massage, just playing with the kids, going out to a movie, all that will help relax you, and then you can start again. Your mind is set, back on start so that you can focus. And being in clinicals or in work, when you do have stress, you can learn from it. Like what made me so stressed today? Maybe next time I'll be a little bit more prepared.
So learn from your past.
Learn from your previous mistakes that were causing that stress. So I think that would help. And then just like they said, prioritizing will help with time management so that there's less stress. God, spiritual, going to church, I think all that will help.
Very well stated. So from Jamie, I get this, that you take care of yourself. You should practice me, myself, and mine. When your cup runneth over, you can give it to others. So for the patient to take home is always take time for yourself. Do what you like, massage, facials, going out for movies, watching a favorite game with your child, whatever you like. Take care of that first, so when you are happy, you can radiate the happiness with the others. Now, our last contestant or last participant for the today's talk is Teresa. She's from Walden University. Teresa is also finishing up her clinicals and she's really done good, and I'm gonna take her expertise on stress management. I know a couple of times we had some situations where we had some hard case scenarios, and I gave you some patients that you had to work with, and you came out with the right answers. How did you do that? Were you stressed out when I just threw you out there and you had to figure out what to do? How did you handle that?
In the beginning, it was really stressful. I felt overwhelmed, but then I just had to, like the rest of the students said, just prioritize and pick out what's most important. With those patients, it's always important to get the most pertinent subjective data, get in there, get it, get out of there, and manage your time wisely. So I just think it's just important to just know what you're going in there to do.
Thank you, Teresa. So listening your opinion, all I gather is stress is a very important part of the life because it keeps you on track. You guys agree with that? It keeps you on track. When you don't have any stress, you don't have your priorities set up. You just feel like going and taking so long, just cleaning your house or taking a long shower because you're not stressed. So having a little bit of stress is also required in our life to keep us on track, organized, so we could prioritize our task. And in my opinion, when you have stress, your body functions in a way that your heart is beating, so you have a lot of blood circulation going to your organs. Your breathing is going up and down, so your lungs are asking for more oxygen. So one way it's healthy as long as we sit back and we talk to ourselves saying, it's for good. Take stress healthily and positively and keep growing up happy thoughts and positive thoughts, saying it's only for a short time. If I'm organized and I'm prioritizing my task, I'm gonna be all fine. So stress at certain extent is required in our life, and we should all know how to deal with it. Starting from our childhood to adulthood, we should have this art built in. So we should take this opportunity to not only talk to ourselves, but to our patients or our family members or even our kids. Thank you for listening and thank you for your opinion.